All right, thank you for staying with us. The Nigeria Center for Disease Control has placed Nigeria at high risk due to the cholera outbreak claiming lives. As it is, there have been over 1,500 suspected cases in the country. As part of interventions to stop the cholera epidemic, NCDC says it is embarking on a coordinated approach with states to identify and deal with the disease spread in affected areas. Ogun State is also one of the states that has some confirmed cases. Well, joining us in the studio is Ogun State Commissioner for Health, Dr. Tomi Kulka. Good morning.
Good morning.
It's good to have you join us.
Thank you for having me.
Now, let's talk about this outbreak in Ogun State and what the situation is. You bring us up to speed with that, and also the state's effort, response to addressing this matter.
Thank you very much. As of date, we have 30 suspected cases because as long as someone presents with diarrhea and vomiting, that fits the description of the case you call, that's what you call the case description, then we start to investigate. And we've had so far 9 confirmed cases with the cholera kit, which does not necessarily, according to NCDC, mean that they have cholera. We still have to go a further step to do the culture, to actually culture the bacteria, which is Vibrio cholerae. And so Ogun State is responding. We've activated our EOC as of the 13th of June, once we had our first 2 cases on the 12th of June. And we continue to respond where we've set up rapid response team in all our 20 local governments. And we have disease surveillance and notification officers, 2 in every LGA. And they comb all the private hospitals and the public hospitals to make sure that we have we capture everyone presenting with diarrhea. What we found is that 70% of cases still present to the private hospital despite the public announcement that treatment is free in public hospitals. So we still have to work hard and heighten our surveillance, particularly along the borders where there's no boundary between Lagos and Ogun State. There's a free flow. 20% of Ogun State citizens actually work in Lagos and commute to Lagos on a daily basis. So we're conscious of that fact and we continue.
All right. Any cases of death so far?
Unfortunately, we've had one case of a 62-year-old lady who actually contracted the disease through her son that she was nursing, her 20-something-year-old nurse that she was nursing. And that was in Agbo in Ijebu North local government, which actually is one of our vulnerable LGAs. We tend to have breakouts every season annually in that local government. So in that particular local government, we've supported them by putting public toilets, the government, and we continue to actually install public toilets. I think they've done about 100. That's the Ministry of Environment. Because the challenge is, because the traditional homes tend not to have toilets. And although there's a law that actually says that every home must have a toilet, and that has been read out to the people of Ogun State, but they're not complying. Everyone should convert at least one room in their house to a toilet. Otherwise, the government has the responsibility to provide a public toilet, or the community can come together and build a public toilet for themselves to ensure that the water is safe.
Sorry, Theophilus, I'm wondering why the people are not complying, is it the fact that the level of awareness with regards to the essence of having toilets in their homes haven't really gotten across to them? They are not educated enough with regards to that.
There's been a lot of awareness creation and sensitization, but also culture. People are used to culture, particularly in Ogun State, because we have the Ogun River, and a lot of communities back the Ogun River, and they think that by actually dumping their waste into the river and it flows along, that it's moved, but they forget that there's another community downstream that's going to actually end up being contaminated, the water being contaminated with the effluents. So I think we still have to heighten our awareness creation so that people do know the consequences of their indiscriminate disposal of their waste.
Absolutely. So incidentally, early this year I did a report on the open defecation on the Lagos-Ibadan Expressway, and there are markets all around those areas which can also heighten this cholera outbreak in the state. What is the state government doing in market areas or public places to ensure that they practice proper hygiene? So
within our market areas, we also have public toilets, and they're the special ones where you don't need to flush. They decompose, and you can actually use the gas produced by the decomposed effluent to actually generate power. So we've been creative and innovative around that. Also, Ogun, which is the waste disposal agency, they have big containers where people are meant to actually empty their waste. But what you find is you find all sorts in those waste. And when it's full, they end up still dumping rather than going to the next container. So our environment agencies out there and being very punitive about making sure that people adhere. Some people have been prosecuted for not adhering to the waste disposal regulations.
So is that enough?
I think rather than being punitive, we continue to create awareness. It's to teach the people. Culture takes a long time to change. Habits that people have had for years. And it's a matter of sensitization and applying punitive measures. And hopefully, one day, we'll all realize that it's for the good of all.
So are we looking at perhaps strategic communication in such a way that knowing that culture plays a major role in their decision-making as it is, influential people, perhaps the chief, and all those community leaders, using them as persons who could educate these people such that the message gets home?
We have a team, the risk communication team, and they constantly go out every day to meet religious leaders, to meet traditional leaders. We actually do what we do, community entry through those people, because you can't just show up and start communicating with the community without engaging their leaders. And that's how we enter most communities. And they've been collaborative, but we still have to keep working at it to make sure that the message, the key messages that we're sending out there is being propagated in those communities.
All right.
So how's the government coping with vaccine availability? Remember, the federal government talked about the fact that we are still waiting for vaccine.
Yes, because the truth is, so far in Nigeria, the vaccine has been used in IDP camps, not routinely. So no state is actually using the cholera vaccine as a routine immunization. So we're still waiting for the federal government to give us the directive. No state is actually allowed to procure vaccine in Nigeria. That's a national directive.
So what are we not doing about the cases that erupt?
The cases can be treated. So the vaccine is to protect people against getting it. Once you've got it, you develop immunity against it. And also, what the people need is to be rehydrated, because the presentation of the disease is diarrhea, watery diarrhea, which could easily dehydrate people, and particularly children. And so we give them IV fluids, we give antibiotics, and just nurse them into recovery. And when the diarrhea is mild, it could be partially treated at home with oral rehydration therapy, which is sugar, a bit of salt. Whilst people are making their way to the health facility, people should not self-treat, so that we make sure, and they shouldn't go to alternative medicine practitioners, because we find that some people are, going to alternative medicine practitioners, which can only lead to their demise, because the electrolytes in their bloodstream is usually unbalance. There's an imbalance, and it's only IV fluids that can correct that. Otherwise, you have an arrhythmia of the heart, and then that's what also leads to their death.
Right. So two questions in one that I will be asking. One is the matter of the alternative treatment. Is the state government looking at perhaps collaborating with these people, teaching them what to do when these persons come to meet them? Because I believe that still based on culture and trust, these people feel that over the years, these are the persons that have gone to my fathers when, got their treatment from these persons. And so I believe them to deliver when it comes to addressing matters of my health. Is the state government looking at collaborating with them as well to know what to do when these persons come?
So we do have an agency, Alternative Medicine Agency, and we're creating awareness amongst our alternative medicine practitioners that please do not treat, refer. And as we said, we have, as I said earlier, we have treatment centers across all 20 LGAs, and all our primary health centers and public hospitals will treat patients, and it is for free. And that is the most important thing, in that they do not have to pay out of pocket. Even on my way this morning at 5 a.m., I got a message from someone from the public saying that this is what's happening. I've taken this person to one of your general hospitals, which actually delighted me. The message was sent at about 3 a.m., but for me, it's actually reassuring. That means the message is going out, and people are responding and going to the right places.
The other question is the matter of schools. Remember that UNICEF actually raised concern, talking about how it's important Nigeria has to address this matter in schools. What is Ogun State doing with regards to addressing the matters of hygiene? We know how free-spirited children are when it comes to they going to schools. They do not care. They do not have any cares in the world. And so they're just free. So what is the state government doing with regards to that?
So we've been very constructive in the way we've addressed that. We have health educators, which are nurses in our schools, and they have been creating awareness and sensitizing the teachers as well as the students at the assembly on what to do, ensuring that there are sanitizers and that the pupils actually wash their hands. We also advise them to make sure that their source of water is safe and that they should not take water indiscriminately. We, as a role, on an annual basis, we screen all the food vendors in our schools, and we give them certificates. And at the moment, we have a task force going out checking that our school vendors do have certificates, and the rogue vendors are actually...
Across the board, both public and private schools?
Yes. Every school that brings their food vendors, we actually screen them. So we don't have as much control over the private schools, but if we go screening and the vendor doesn't have, we actually have punitive, we have punishments for those. They get prosecuted.
Okay.
Interesting.
So you mentioned earlier about the fact that people are still going to private hospitals, 70% of...
70%.
What is the government doing to build trust? Because there's been this, over the years, lack of trust in public health facilities.
Well, we do know in Nigeria that 70% of people seek health from the private sector. But one of the reasons is the non-conducive environment when they get to the hospital and lack of health workers. In Ogun State, what we've done is we started renovating our primary health centers and public facilities so that when people come, they get a conducive environment where they could sit and receive care. Secondly, we have redistributed our health workers, recruited and redistributed, because there is inequity between urban and rural areas. So we've looked at local governments, look at their staff, and sort of redistribute and making sure that there's a balance in the number of health workers. We've also, during our renovation and activation of our PHCs, we make sure that there is accommodation for our health workers, which then means that 24/7, when people come, they meet a health worker. What had happened in the past is because of lack of accommodation, the health workers, they're human as well, so they close shop and go home. But once we've provided accommodation, we expect them to be there so that the public knows that even if they get there at 3 a.m., there will be someone to attend to them.
That's across board because the Lagos-Ibadan Expressway corridor, people that stay around there will say that there's lack of government presence, especially when it comes to health in those areas.
You're absolutely right. It's an area of concern for me in particular, in that it's a new community that's just evolved over the years. We do know that we don't have a general hospital there. It's in our budget, and these things take time, but it's been something that's been a burden to me personally, that there has to be a government presence. But we do have primary health centers along that corridor, and they can be referred. And we've also decided to work in collaboration with the private as well. In that axis, you have the Redeem. They have a good secondary facility that people can go to. There are other private hospitals, and I don't think that the lack of presence of the government general hospital should hinder people from seeking help.
Perhaps they are looking at the state of the primary health care centers. That's a major concern for a lot of people, because ordinarily issues like this, talking about the outbreak, cholera outbreak, is supposed to be addressed at the primary health level.
Absolutely.
But if what is needed are not present, most persons wouldn't want to go to such areas. They'd rather go to private hospitals that are readily available and accessible for them.
As I said, we're working on, we've done about 100 primary health centers that we've renovated. Our strategy is to renovate at least one primary health center per ward, and we have 236. And the governor has just made funds available to even complete the 236. So in about a year's time, every primary health center will be renovated with accommodation, with reliable power, most likely solarized, and good water supply, which would be a borehole, and even electronic medical records, because we're rolling that out across Ogun State. We've done it in our tertiary hospitals, we're doing it in our state hospital, and the phase we're in right now is our primary health centers that we're digitizing them. So it's a process, because there's been a neglect of the sector for a while, a few decades, and to actually address all the challenges that we made, the dilapidated structures, the old equipment, the lack of staff. It takes time.
Human resources.
Yes.
Another major
issue. And when you're building a system, it has to be done, deliberately to ensure sustainability, because if you do it in a haphazard way, then once this administration goes, then there won't be any sustainability. Yes, so that's what we're taking our time.
Issue is the availability of potable water, because at the heart of this is the provision of water supply to most households, if not all as it is, and that's the responsibility of any government as it is. And we know that that has been a major issue, which also UNICEF, I think WHO also spoke to that. Governments across levels need to provide potable water to homes to really address this issue.
So on that note, our water corporation has actually tripled its output in areas that they have pipe water, waterborne. Also, the rural ministry, I think it's called rural ministry, yeah. They have been sinking boreholes through the WASH program. They've been sinking boreholes, and those are reliable water sources. It will take time because, as we said, all these things have been existing for decades, and to address the water needs of 7.1 million people overnight, it's going to take a while. But we're systematically going through that. Right now, our response is multi-sectoral. It's not just health. We've engaged environment, water corporation, education, and even West, which is the local government waste and environmental services. They are involved in this response. So it's not just the health sector, it's the entire state government that is responding to this emergency outbreak.
So talk to Nigerians about lifestyle that they need to engage to help in reducing the spread of this cholera outbreak.
So I'd like to advise us that cholera is borne by water and food. So the first thing is we must always wash our hands before our hands reach out for our mouth, before we eat and after we've been to the toilet. Also, foods must be thoroughly cooked and fruits must be washed properly. Our water source must be clean. And if you're not sure of your water source, please boil your water. And if you can't boil, a drop of chlorine, very little drop of chlorine, or get chlorine tablets and leave it for 30 minutes. That would help make sure that the water is free of bacteria. And please, please, please avoid open defecation. And if you do see anyone that is vomiting or excessively or diarrhea, watery diarrhea, which we describe as rice water stool, please report to the nearest public hospital, and there will be ambulances in Ogun State to pick anyone from where they are to the public hospitals.
We spoke to some persons on the streets of Lagos, and they said they've never heard what cholera is, that there's an outbreak, that there's anything of sort. Yes, the truth, adults, as it is, and these are parents to children who are going to school. How then would they pass the message across to their children when they themselves are not aware? So I'm wondering how the state government is creating awareness with regards to this issue and the level of perhaps education of people with regards to this outbreak.
So we've been extremely strategic about our dissemination of information. I personally, this is my third time in the last 72 hours being in the media, radio, TV. As I'm here, I have members of my team on radio and TV in Ogun State. So we are there on a daily basis. We're working with our media colleagues. And it is key. I think it's not just the health professionals. We can use your sort of medium. When we are not here, you could easily pass on the information, because I think we've given you enough information to help us out, to advise people on basic, lifestyles that they can use to actually avoid this.
But how about those who do not have perhaps TV, radio, who do not have any source of electricity?
Oh, we have town criers. Actually, yeah, we have town criers in the rural. I have a video.
Really?
We have town criers. No, because this is not a new thing. It's an annual thing. This is a public health issue. And we actually have town criers that we pay monthly to actually disseminate health information in our rural areas. How do we get women to have immunization? How do we do our malaria campaign, hypertension campaign? They're there all the time. So we've just mobilized them to actually disseminate this information. And also we have those trucks, the information trucks that you see in markets where they're telling them. There was one recently from Magboro that was saying there's cholera in Magboro and was recorded, but people misinterpreted that as that. They didn't see it as a health message. They saw it as an alert, so...
Now, that's an issue.
No,
the way the information is presented.
So that is what we picked on, and that we needed to pick up that person and re-educate them in the way they were disseminating. Personally, we prefer to have standardized, pre-recorded messages that they just slide into a device, and we've done that. We bought over 100 devices that just play, they've got Bluetooth. You just play the message and they drive them around townships to actually alert the people of the presence of
no matter how busy you are, wherever you are, you must get the message.
But interestingly, Nigerians seems... It becomes, I think there's a lot of background noise that people don't hear key messages. This is not only the incident. I've picked up other issues where we've been out there, and I was convinced I've done a lot of publicity, and I still find people saying they don't know. We have actually looked at this, data on how people in Ogun State receive information, and we know that radio is key, and we know the town criers are key. But people, I guess, they're preoccupied with a lot more other things that they actually, they take it as background noise.
You know that people stay in Ogun State and work in Lagos.
Yeah.
So in order to beat the traffic, they act like Lagos people and leave home at 4 a.m., 5 a.m. to beat the traffic. Perhaps maybe you should be strategic in passing out information. Coming out at that early time will not be a bad thing.
No, but yes, it is. But I also have to cater for the security. So it's a balance.
Looking at moving forward from now, how the state intends to curb perhaps the spread of cholera, knowing that this is practically an annual thing, although this time around it's full-blown, it's getting full-blown because of the number of cases that we're witnessing. We know the rainy seasons and all of it, how the state is planning strategically to addressing this matter.
As I've mentioned, we in the Ministry of Health, we are creating the awareness and we're making sure that we treat people that have been infected and we trace their contacts and disinfect their homes before they return home. So that's very key to make sure that from that next is that it doesn't go up. The next thing is the environment. The Ministry of Environment is very key, more than health, in this response, in that provision of clean water, which they're doing, provision of toilets, so we're doing that as well, and also prosecuting landlords that fail to put toilets in their homes. That's going on as we speak.
How about collaboration with Lagos State, knowing the proximity, so that cases wouldn't, because you mentioned it earlier, that about 20% of persons living in Ogun State working in Lagos. I think you mentioned
the collaboration with Lagos State is standard. We collaborate all the time. I was still on a phone call with the Commissioner of Lagos yesterday. Okay. So we collaborate, we speak, because really there's no boundary between the two of us. And our responses, both in health and other sectors, are actually usually joint. It might not be visible to the public, but we do work together hand in hand.
So talking about collaborations, the Commissioner for Health in Lagos says we should not take tiger nut drink or zobo. So do you also collaborate in that information?
To be honest, 8 of the first 8 cases of cholera that we had in Ogun State had traveled to Lagos, and 6 out of those had tiger nut milk. So, yes, and so it's not the tiger nut milk itself. When you look at it, it's the unlicensed one, which makes you query the source of the water with which they had made the drink. When we had an outbreak last year, we traced it to sachet water, and the people that actually had the cholera had drank the same batch of sachet water. So we traced it back to the factory and found that they were not registered with NAFDAC, and their source of water was not clean. So you can always trace things back to their source. And I think it's just been working with NAFDAC, working with all agencies that can help us. And Nigerians, I suggested this, but people laughed at me that looking at the NAFDAC number, but I've been told that the NAFDAC number, that people sometimes write fake NAFDAC number.
Absolutely.
Yeah.
I was going to ask that, does a registered product necessarily mean that the product is safe?
Well, the thing is, there are many manufacturers, and it's a matter of inspecting them. Our environment ministry, they go out and check those water producers, and they actually shut a few down by testing the water. What we advise people also is talking about safe water. If you have a well, wells are shallow and they tend, during rainy season, the waste can be washed into people's wells. So get your well tested. Invite us from the Ministry of Environment to come and take a sample of the water and test it. Even your borehole, you can test it to make sure that you're getting clean water. If they culture it and they find coliform, which is a bacteria that you find in feces, it means that there's fecal contamination of that water source. And that's how we have been actually checking the water-producing companies to make sure that their water is safe.
The states perhaps might have not done enough in terms of media engagement to talk about these things. Like you are mentioning that some factories producing table water were shut down last year. I'm not sure.
Not table water, the sachet water,
yes.
yeah.
So it was shut down last year. I'm not sure it's in the news.
It was last year in Ogun State. It was a few. It was I don't know how the Ministry of Environment. I can't comment on that, but it was in the news. So we'll continue to engage the media. I think it's the media and health should work hand in hand, because you are our voice to the public,
And that's why we're here, and that's why we have you here.
Absolutely, and that's why I never turned down any media engagement. Coming here, I was chatting with a journalist and giving him information about this cholera. I'm non-stop, 2 a.m., 7 a.m., they're on my phone asking for information. And I never see it as a burden, because where my voice cannot reach, I know yours can reach those areas.
Now, let's look at perhaps communities that have been identified as being vulnerable. What is the strategy of the states, especially these ones, especially what was identified as making them vulnerable, and then how the states intends to quickly address that as it is? Yes, you had mentioned that the matters of vaccines are not readily available as it is, except
Nigeria is not providing the vaccines to states for routine immunization as of now.
As of now?
Yes.
How soon is
there is no discussion on that as of yet. So
okay, because I thought I saw something in the papers where the government was talking about giving vaccines to states or something like that, but that's an aside. But then the vulnerability of these communities, how the state is looking at addressing them.
So I'll give you an example. The Okiagbo community that I said we identified last year. Well, we went in, we realized that they had a borehole, but it was on one part of the community. So obviously the entire community probably don't have access, and they had to pay for it. So what the government, that was a community borehole. So what we did as a government is we went into that community and created another borehole at the other end of the community. That was free, so that anyone could access water without having to worry about paying. Also, in all our primary health centers, wherever we put a primary health center, there's a borehole, which is a clean water source. And we make sure that we have pipes and taps on taps across about 6 taps outside the PHC, so that the public could actually come and fetch their water from the taps for free. So those are the things that we're doing. Also, public toilets. I told you that.
How many does the state?
We've done 100. They continue to do that. That's just the government. There are also PPP arrangements where some private people actually build toilets and make it available for use at a very low cost, particularly around markets.
So how has this helped in reducing the spread? And of course, not just cholera, but other waterborne diseases.
Well, it takes time, because it's data, actually collecting data, and that's why we introduced electronic medical records, so that we can start capturing quality data that would inform decision and also show the impact of any initiative that we've implemented.
Speaking about data, a lot of matters that have to do with health issues, data is key if we want to address it critically. How is Ogun State able to, put together the data as it is, and what's the data reading right now with regards to the spread of cholera, and how is it applying that?
So at the moment, we have electronic devices that our disease surveillance and notification officers have on the field, and they fill that in, and it comes into the epidemiologist, who analyzes it on a daily basis. Our emergency operations center was activated on the 14th of June, and we've been active since then. We meet on a daily basis. We've had the collaboration of NCDC. They're present on our EOC. Sometimes it's physical, sometimes it's online, which makes it convenient to convene as many people. And as I said, we've had, even as of yesterday, 30 suspected cases, 9 confirmed by the RDT, and we're still waiting on cultures for a few of them to make it confirmed cases. We've unfortunately had 1 death, And the contacts so far that we've traced are about 33 contacts of people who have had the disease. And we've decontaminated the homes of the patients discharged. The patients discharged so far have been about 25. We have 3 on admission at the moment.
All right. Okay, we'll have to leave the conversation here now, but we must thank you, Ogun State Commissioner for Health, Dr. Tomi Koka. Thank you so much for your